This is behind all this are actually four current applications, which I'll try to point out as we go. And by the way, we've acknowledged that we've been working with you guys on this, you and Memorial Sloan Kettering. So basically what this demo is showing is Watson's ability to synthesize information about a patient. The challenge being that most of the patients have very long healthcare records, and for a doc it's very difficult to look at that record longitudinally and pay attention to everything that's important about us. Watson can do that for the doc, synthesize the information, display pertinent facts on the patient to the doc very quickly. It also, this particular demonstration shows how Watson can identify for the doc other information that he or she may not have thought about that's important in the particular diagnostic situation. And the other most important thing is that when we understand something about a patient, when the doc understands something about a patient who goes to make decisions about what the most likely treatment is, Watson can make recommendations about the most likely effective treatment and bring up the evidence that supports that recommendation. So it gives the doctor very rapid access to very pertinent information about the treatment recommendations. So they'll have to search and that's basically what it is.
Whatever it is.
So we have a little scenario here. Dr. Stone's a medical oncologist. This is partly based on the work we've done here.
Based on what you told me,
he has a patient who's coming in for a second visit. First visit, they did just general things. The initial diagnosis today is a conversation about, okay, given what we're dealing with, what's the best thing to do? So, right before Dr. Stone sees the patient, he signs into the system. And he's presented with a list of patients that we already have information on. He sees that Mrs. Smith is not actually on this list yet, and so the first thing he wants to do is add her. And in essence, what he's going to do here, as he clicks through, is he's essentially saying to Watson, "Okay, Mrs. Smith is our patient. What I want to do is import all the information that's relevant out of the EMR about Mrs. Smith, and I want you to start processing that so we start to understand her fast." So this is just meant to illustrate that we're pulling in information from everywhere. Now what Watson is doing is operating on that unstructured data, and the structured data is involved in it, and looking at the literature relevant to what this oncologist is interested in, and essentially saying, given Mrs. Smith's circumstances, what's the best thing to do? Okay? And what Watson's doing is very rapidly analyzing this kind of thing. These are roughly the numbers we're at the moment in our corpus improvement. So after Watson has operated on